Hello dear students, this is Dr. Rehman. We are going to start with the next topic, which is called necrosis. So what is necrosis and what is apoptosis? As you know, there is a man. This is first man. This is second man, human. This is human number 1. This is human number 2. When this human dies, God forbid, when this human dies during accident, and when this human dies by its own, so we will call that accidental death necrosis, and the death by its own means that after completing its life, after completing its program, it is called apoptosis. So simply, what is necrosis? Necrosis is accidental cell death. Accidental cell death is called necrosis. So necrosis, we have two patterns of necrosis. One is coagulative necrosis, one is liquefactive necrosis. So as you know, what is coagulative necrosis? Coagulative necrosis. So what is coagulative necrosis? As you know, coagulation means denaturation of protein. So when a cell death occurs due to denaturation of protein, that is called coagulative necrosis, and it is a most common pattern of necrosis. What happens when the protein is denatured? The cell, when the protein is denatured, for example, this is a cell, and this cell death occurs due to coagulative necrosis, means inside the cell there is denaturation of protein occurs. So as you know, the cell structure is preserved, the cell architecture will be preserved, cell tissue architecture remains preserved. This is very important. In the coagulative necrosis, tissue architecture remains preserved. And in which organs the coagulative necrosis occurs? So simply, infarction of solid organs, ischemic infarction. As we know, ischemia is the main culprit of the cell death. So ischemic infarction to the solid organs like heart, kidney and liver. These three are the main organs. Where coagulative necrosis take place, and heart is the most common. Here inside the heart and kidney and liver, denaturation of protein take place, but the tissue architecture remains preserved. I again emphasizing upon this point. Examiner always asks this question: is brain ischemic infarction is coagulative necrosis? So your answer will be no. Brain ischemic infarction is not a coagulative necrosis. It is actually a liquefactive necrosis. So this is a coagulative necrosis, the most common pattern of necrosis. Denaturation of protein take place, the tissue architecture remains preserved. In the solid organs like heart, kidney and liver, it take place. In the brain, is ischemic infarction take place? No. Why not? Because in brain there is absence of collagen. Collagen is a protein which is present here, so there is a denaturation of protein take place, but in brain there is no ischemic infarction. As you know, there is no collagen present. When there is no collagen present, it means that there is no coagulative necrosis. Now the second type of necrosis, which is called liquefactive necrosis. So L for L, due to lysosomal permeability, enzymes leak out. Means this is the cell, this is an organelle called lysosome. When inside lysosome, enzymes are present. When these enzymes are leaked out from the lysosome, it damages the cell. and that is called liquefactive necrosis. Due to lysosomal permeability, enzymes leak out. These enzymes damage what? The cell, and this damage is also called hydrolytic damage. But remember, here the tissue architecture will be lost. Why the tissue architecture will be lost? For example, this is the cell membrane. In the cell membrane, there is a phospholipids present. When these phospholipids are damaged, the cell architecture then becomes like this. So the cell architecture lost, tissue architecture here lost, here tissue architecture remain preserved. And in which give me doctor examples of liquefactive necrosis. So ischemic infarction of the brain is an example of liquefactive necrosis, because there is no stromal support because of the absence of collagen. So brain is rich in liquefactive enzymes. So these liquefactive enzymes are responsible for ischemic infarction of the brain. And the second most important example is infections. Now we will discuss special types of necrosis. So one is gangrene necrosis. And doctor, where gangrene necrosis take place? Very important MCQ. So your answer will be in the lower limbs. If somebody asks that, doctor, give me examples of gangrene, your answer will be dry gangrene and wet gangrene. Dry gangrene, in which the tissue architecture is preserved, and we have discussed tissue architecture remains present in what kind of necrosis? Coagulative necrosis. And second, the wet gangrene, in which the tissue architecture remains lost, and tissue architecture lost in liquefactive necrosis. It is an example of liquefactive necrosis. And we have also discussed that liquefactive necrosis is also due to infections. So due to bacterial contamination, toxins or enzyme release, the wet gangrene take place. So these are the special types of the necrosis. So now let's move towards a next example, which is called caseous necrosis. And caseous, it's called like this, of the cheesy appearance. At the end of this necrosis, a cheesy appearance is showing. So therefore it is called caseous necrosis. In cheesy appearance, you have seen yellowish white debris. So when a necrosis and you are seeing that there is a yellow white debris, so your answer will be caseous necrosis. And caseous necrosis you can see where? In the TB you can see. This is a classic multiple choice question, MCQ question, that in the TB, tuberculosis, which kind of necrosis is seen? So your answer will be caseous necrosis. And cheesy, due to presence of, why it is cheesy? If an examiner asks why the caseous necrosis is cheesy, so your answer will be due to the presence of mycolic acids. So these are the examples, these are the multiple choice question, MCQ questions I'm again and again repeating. On microscopic examination, you will see coagulative plus liquefactive necrosis. So it is example of both coagulative and liquefactive necrosis. It means that some area the tissue architecture will be remain preserved, and in some area the tissue architecture will be lost. So you will see amorphous granular pink structures, which are considered as a variant of coagulative necrosis we have discussed in the old section. Now let's move towards the third type of necrosis, which is called fat necrosis. So fat necrosis is due to enzymes and due to trauma. It's maybe due to enzymes or due to trauma. So in enzymes, in acute pancreatitis means in the pancreas there is acute pancreatitis. The inflammation of the pancreas is called acute for the short duration of time is called acute pancreatitis. When there is a acute pancreatitis, lipases are released, lipase and enzyme are released. So this lipase act on the pancreas lipids. So when this lipase acts on the pancreas lipid, it releases fatty acids and these fatty acid combine with calcium, and this process is called saponification. So if an examiner asks what is saponification, so your answer will be the combination of the fatty acid and the calcium. And where saponification occurs? In the fat necrosis, and you will see what? Chalky white appearance. In the cases necrosis, we have seen cheesy appearance. Here you will see chalky white appearance. Suppose this is a normal fat cell, and you can see the nuclei here, means at the periphery, eccentric nuclei. This is called eccentric nuclei. So when this eccentric nuclei disappears, mean the fat cell becomes anucleated. Now this cell is called ghost cell. This cell is called ghost cell, and normally you can see here the basophilic deposits, but when there is a calcium, when there is these basophilic deposits are increasing in number, it is suggestive of calcium. It is suggestive of calcium deposits. So simply remember this, that it is due to the fats and saponification process, and ghost cell. Must remember what is ghost cell. Anucleated fat cell is called ghost cell. And fat necrosis is also happen due to trauma. Trauma of what? Trauma of the breast infection. When breast infection trauma occurs, it is also a classic example of breast infection. I will provide all these pictures in the PDF, so contact me in a WhatsApp channel. Go to WhatsApp channel, from there go to the channel about, and there tech and from there contact with me. I will provide all these notes in the colorful version as I have prepared. Now the fifth example is fibrinoid necrosis. What? Fibrinoid necrosis. So fibrinoid necrosis is due to the presence of fibrin. Due to the presence of what? Fibrin. When fibrin combine with immunocomplex. Immunocomplex means antigen plus antibody combination. When fibrin combine with antigen plus antibody complex, it leads towards what? Fibrinoid necrosis. And in fibrinoid necrosis, what happened? The vessel wall damage due to what? Due to coagulation pathway. Due to coagulation pathway. Now this is a coagulation pathway. Due to coagulation pathway means the clotting pathway. Vessel wall damage. Now the coagulation pathway is activated. It is not a coagulation necrosis. It is a coagulation pathway, and it leads towards fibrin formation. If somebody asks that give me examples of fibrinoid necrosis, so your answer would be vasculitis. We will discuss these diseases in the cardiovascular system, malignant hypertension, and polyarthritis nodosa. All these diseases we will discuss in the cardiovascular system, CVS system. And on microscopic examination, you will see this is a blood vessel. This is a blood vessel. Here you will see pink amorphous homogeneous structures, pink amorphous homogeneous, and this is an example of fibrinoid necrosis. I will provide these pictures in the PDF portion. Now let's discuss what is the difference between necrosis and apoptosis. So necrosis is due to lysosomal permeability. We have discussed that due to lysosomal permeability, enzymes leak out, and these enzymes do what? As I have discussed, that these enzymes act on the phospholipids. So cell membrane damage. When the cell membrane damage, it leads toward what? Intracellular content leak outside and act as a chemoattractant. Chemoattractant means the intracellular content will leak out. The body will respond what? Inflammation. Chemoattractant, inflammation becomes. So remember, necrosis is always pathological. It is always pathological. On the other hand, mitochondria is involved in apoptosis due to increased mitochondrial permeability. But remember, the cell membrane here intact, no leaking. If there is no leaking, so no inflammation. Leaking leads to inflammation. So in apoptosis there is no inflammation. And apoptosis, remember, it is both physiological and pathological. In the next lecture we will discuss apoptosis.